Welcome to the University of South Carolina College of Pharmacy Podcast. I'm your host, Margaret Gregory, and today we're having a conversation with Dr. Jordan Ballou, Interim Associate Dean for Student Affairs and a Clinical Associate Professor in the college. Dr. Ballou, welcome, and thank you so much for being with us.
Thanks, Margaret. I'm happy to be here.
First, let's talk a little bit about your role in the college. For our listeners, explain a bit more about what you do in support of our student pharmacists.
Absolutely. This past year, I've been serving as the Interim Associate Dean for Student Affairs here in the college. So overseeing sort of all things student experience and, professional development, career exploration, leader development, things like that. I also, though, and previous to taking on this role, have served as the director of our community-based residency programs. So that's not quite student pharmacists, but it's supporting pharmacy residents who are out practicing in various community settings across the state.
You have a great passion for community pharmacy, and much of what you do focuses around that particular area. How did your interest evolve into community pharmacy?
Yeah, it's a great question. When I was really the summer between my freshman and sophomore year of college, I got really just a random summer job working at an independent pharmacy in my hometown. It was kind of a friend of the family that had just opened an independent pharmacy that was named Community Pharmacy. So I started working there really just as a clerk, kind of checking people out, stocking shelves, sweeping the floors, things like that. And very quickly during that summer realized that pharmacy was my path for my career. I learned so much, and during my time there, I really worked there almost 10 years from the time I started until I graduated pharmacy school, working on summer holiday breaks and things like that. And I felt like I learned so much from the owners of that pharmacy, their names are Mike and Mark, about how to care for your community and the importance that the pharmacist provides to the community as not only a member of the healthcare system, but also a member of the community, right? And how well you could care for your people in a pharmacy.
How do you take that passion and convey it to our students?
Yeah, I think one of my core values is fun. And so I really try to exude fun and make things fun for our students. And so I feel like by exhibiting my passion and being willing to be vulnerable with students and show them how excited I am about community pharmacy, hopefully translates and makes them excited about community pharmacy or whatever path it is that they're interested in. Certainly, I love community pharmacy, so I'm biased, but I just really love helping students kind of find the thing that makes them excited and sparks their passion. And so I really try to tell them about real life experiences, the things that I have gotten to do in my career, the type of patient encounters that I've gotten to participate in, the problems that I have helped solve for patients, and how well you can do that when you are seeing them every month in the community pharmacy. And so I try to demonstrate that to our students so that hopefully that's a pathway that they want to follow as well.
You mentioned earlier that you also serve as director of the USC Community Pharmacy Residency Program. I know it's affiliated with the Kennedy Pharmacy Innovation Center. What is your role specifically in leading that portion of the program?
Our program is, I think, really unique in that we have actually two programs in our community-based residency. We have our PGY1 program, which is really centered around patient care. We have residents at multiple locations across the state of South Carolina. Some are in independent community pharmacies, not dissimilar to the one that I kind of grew up in. And we also have some at a federally qualified health center, which is, more of a clinic-based type of pharmacy practice. And so we have our PGY1 program, but we also have a 2-year program, a PGY1 and 2, if you will, that is Community Pharmacy Administration and Leadership. And so in that program, residents spend that first year really focused on patient care, similar to what I just described, but then they spend that second year focused on administration and leadership. And so we're really training the future leaders of the profession, of their practice settings, wherever they might go.
So I understand that we have multiple locations for our residency training programs, some in South Carolina, one in Georgia. Tell us a little bit more about what our residents are doing at those locations.
Our residents are directly in patient care. They are working alongside other pharmacists. They're preceptors. They're working alongside pharmacists. As in the clinic-based sites, they're working right there alongside providers, physicians, nurse practitioners, nursing staff, they're right there in it. And so our residents are getting to provide care to patients where they are. I think that's the best thing about community pharmacy is that you're meeting the patients where they are. All of our residents are participating in chronic disease management. So they are helping patients manage chronic conditions like diabetes, hypertension, heart failure, pain management, all sorts of conditions, and really helping the patient to have the most knowledge and education that they can to manage their disease state on their own, empowering the patient to be a part of their healthcare team too.
Talk a little bit about the locations and where they're specifically located.
We just started a new residency year. So for 25-26, we have residents at Hawthorne Pharmacy, which is here in the Midlands. So Hawthorne has multiple locations, and our resident gets to experience both the locations that are just a few blocks away here in downtown Columbia, but also out in more rural areas like in Kershaw County. So they get to experience different patient populations depending on the location. We also have a partnership with Hope Health. Hope Health is a federally qualified health center that's in the Florence area. They actually have multiple locations too, really all over what I guess would probably be the PD region of South Carolina. The resident there is primarily in Florence. And then our third location is with Premise Health. So Premise Health is the nation's leader in providing employer-based health services to manufacturers or other large employer groups. And so our resident is actually at B&W, at the B&W plant. There is a health clinic there for the associates, and our residents are there in the clinic seeing folks that work for B&W. And then our fourth location is all the way out in Carrollton, Georgia. And so you might be wondering, how did we get that worked out? But that is also a Premise Health partnership. And so Premise Health also manages a clinic there that's called Wiggins Family Medical Center and Pharmacy in Carrollton, Georgia, caring for the folks that work at a company called Southwire. So very similar model, providing care where the people are, where the employees are, so that they can get the care that they need convenient to them while they're right there at work.
Are there any plans for the future to expand the residency training program further?
I think we're always interested in expanding the residency program. I believe that supporting residency training as a college really fits our mission in multiple ways. Not only is it supporting us in serving the people of South Carolina, it's also allowing us to advance the profession of pharmacy. So by having these advanced practice trainings, we are equipping practitioners, right, with more knowledge, more skills to go out and advance the profession of pharmacy. So I think that's always something that we're interested in. And really, if the right partnership aligns with another independent pharmacy, another clinic, things like that, I think there's always opportunities for that. And that's not something that just I'm focused on. We have other folks here in the college, Dr. Brandon Bookstaver, Dr. Reagan Barfield, who are heavily engaged in residency training as well, and with other partners. And so I think that's something that we're really committed to as a college.
One of the things that I wanted to ask was why it's important for the college to provide these types of residency training opportunities. You answered that a little bit, but talk about how it benefits our students overall and benefits the college overall.
All of our residents are required to do a number of things. Of course, they're providing their patient care at their site, which I've already talked about, but they're also required to do professional service. So serve in a professional pharmacy organization. They are given the opportunity to do professional advocacy, doing a letter writing campaign, going to the State House and advocating for pharmacy, things like that help advance the profession. They are also, at least in our program, all required to participate in the clinical teaching certificate that the college offers. That is sort of a statewide program for residents all over the state. And so our residents participate in that too. And they then are expected to precept students at their site. So they're precepting students on rotations, but they also come here to the college and they get to teach in the classroom. And so our residents are giving back to the college by teaching our students, and we are giving to these residents by teaching the new teachers, training the next generation of pharmacy educators as well. And so I think that our students get benefit because they see sort of a near peer, right? A resident is often, not always, but often a fresh graduate. They just finished pharmacy school. And so our students getting to see this person that is a near peer to them, that was just in their shoes, that is now out there in the workforce, right? And so students getting exposed to that, I think shows them what they can aspire to. And then also that they get that potential mentorship and guidance as well.
I would be remiss if I did not mention that just last month at the South Carolina Pharmacy Association's annual meeting, You were the recipient of the 2025 Ken Couch Mentor of the Year Award. Congratulations.
Thank you so much.
What does it mean to be recognized in that way by your peers?
It's a huge honor. I don't do the work for the recognition, right? I think that's probably a cliche to say, of course, but I feel like it's my obligation to mentor others. I've had so many great mentors throughout my career who have supported me, who have lifted me out, who have drugged me along with them. And so I try to do the same for others. The best thing that we can do is to turn around and say to somebody, why don't you come with me, right? This is where I'm going. Why don't you come along? And so I think I'm in a really great position to be able to do that in a college of pharmacy, right? I position myself well for that being a passion of mine, to have no shortage of people that I can turn around and say, this is where I'm going. Why don't you come with me? I just think that that is so vital for the future of our profession, that we sow into those who come behind us and not only show them the way, but bring them along and kind of stand up there next to them, and then eventually push them forward, push them ahead of us, so that hopefully they can be even better than we got to be while we were here doing it. It's a huge honor, and I'm just so appreciative to SCPHA for all of the support that I get from them, as well as the opportunity to continue to serve our profession in what I put into SCPHA as well.
I know that your undergrad is from NC State University, and you attended Campbell University for your Doctor of Pharmacy degree. And you've been here at the College of Pharmacy for 3 years now. So what does it mean to be a Gamecock pharmacist?
Well, I tell this story a lot. So when I came and interviewed here back in 2022, I got to meet with some students as part of that interview. And I remember just being so impressed by them and their willingness to kind of share with me as a stranger about their hopes and their fears. And they were in a kind of a group of peers and talking about challenges that they had experienced. And they were willing to share that in a room of peers and a stranger. And I remember leaving here and thinking, I really want to be somewhere that cultivates that in their students. And so to me, that was really the draw for me. And now that I have been here for 3 years, I feel like that's still true. I think the things that we sow into our students here in this college that make them realize that they're part of a profession, right? They are part of something bigger. And it takes all of us to meet the mission, whatever the mission is, if it's the mission of this college, if it's a personal mission, if it's the mission of the profession of pharmacy, it takes all of us, and the teamwork and camaraderie that I really found very meaningful when I was even inquiring about a job here. So I have found that to be true in my time as well.
Dr. Ballou, it's been a pleasure talking with you today, and thank you for sharing your insights about the USC Community Pharmacy Residency Program.
Thank you for having me. I've really enjoyed this opportunity to speak.
And thank you for tuning in to the USC College of Pharmacy podcast. Stay up to date with the latest in pharmacy education and innovation by following us on iHeartMedia, Spotify, and YouTube, where you can explore our full library of episodes. Until next time, I'm Margaret Gregory, reminding you that the future of pharmacy begins here at USC.